infection prevention and control. Please wash your hands. Infection prevention.
Now let us go through the components. We just outlined the components of reproductive health. The first component is family planning. We shall talk about family planning in details, but I'm just listing down the components. We shall explain the components one by one after. We have adolescent reproductive health. That component is to do with adolescents. We shall see how they should be cared for, what their needs are. We shall see that as we get to that bit. We have maternal and child health. And maternal and child health, I mean the safe motherhood that you already know. That is the maternal and child health. We shall need to know what maternal and child health is, which pillars, what are the components. We have the other component as sexual transmitted infections, including HIV/AIDS. That is the master infection. So there are very, very many, but we shall need to look at one by one and digest that. Now, my dear learners, in this course unit, reproductive health, we shall also have a component known as post-abortion care. Post-abortion care, we shall see how to care for mothers, how to prevent it comprehensively, and all that bit. So we shall also look at sexual gender-based violence is a component. If time arises, we shall also look at female genital mutilation, and then we shall look at elimination of mother-to-child transmission if possible. Those are the components that I prepared for you that we have listed. We now need to go into details about those components. But before we explain those components one by one, by the way, they are big. We need to give in a lot to be able to discuss all the components fully because they are a bit big. But that doesn't scare you. Knowledge is power. You need the knowledge, you learners. Okay. Before we talk about the components, we need to know that reproductive health is always integrated. So it is an integral course unit. We have to integrate it in other services. Integration of reproductive health services. What does integration mean? Integration means a way of providing complementary reproductive health services to suit the needs of the clients with the least inconveniences to the clients, thereby promoting quality of care, acceptance, continuity, and clients' confidence. Anyway, integration is a way of providing complementary health services to suit the needs of the clients with the least inconveniences to those clients. Ideally, integration means that the service provider is able to meet all the clients' reproductive health needs at a particular visit. So we have to integrate services. I can give you an example. It's hard to find a client. By the way, in reproductive health, they are called clients because they are not sick as such that they are bedridden in medical ward, psych ward, but they are clients. We call them clients, not patients. It is rare to find a client say that I'm going to maybe Mengo Hospital, Rubaga Hospital, Mulago for reproductive health services. But people access those health units, very many of them, regional hospitals and health centers and all that. They visit them because they have certain challenges with their health. For example, Madam X or Madam A could have some fever and probably headache and diarrhea. Then she comes to the health unit. For her, she comes thinking that she's going to get maybe blood taken off to find out, to investigate malaria parasites, or they are going to be given, Madam A is not going to be given just medication, then she goes home. If she comes to you, yes, she's suitable and bona fide to get those services regarding her illness. But you also need to learn that you have to integrate reproductive health services For example, yes, she has fever, headache, and diarrhea, but you do not know whether the cause is HIV. So after finding the history and finding out what the problem is, you have to integrate a service of counseling and testing such that she's aware whether HIV is then causing the symptoms or not. You can refer the person to the violence clinics. Probably she might have been maybe kicked or violated in any way, and that's why she's having the symptoms that for her she thinks is malaria. So you have to integrate services according to the need. Okay, let's look at Mother W. Mother W comes with the bleeding, blood loss per vagina, and she comes to your center, and you have to find out why she's bleeding. But for her, she thinks when she comes, you just clean the uterus of its contents, give her some medication, and she goes home. Here you are not going to do that only. You'll integrate services. You'll make sure by the time she leaves your center, she's cancelled. Probably she didn't want the fetus, the baby, and she aborted. So she's cancelled. This person needs to still go for STIs investigations, because are you aware whether STIs are the causes of the abortion? So when you take histories and find out what really it is, you have to refer this client. If Madam W is a young girl, an adolescent, you send her to the reproductive adolescent clinic such that she also finds services. So integration is very important, because by the time the client leaves the center, at least they have got a number of services at a one-stop shop. Okay, do you have questions so far? We need to look at the aspects of service delivery where integration can occur. In other words, how do you integrate services? How will you integrate services? People, you're going to integrate services by providing information and educating clients. So if you educate them, they will know, oh, probably I need to go for counseling and testing. I need to go to a violence clinic. I need to go for ARVs positive. I need to do this. So it's very important. The other aspect is counseling. When we counsel them, they make their own decisions on what their problems are and solve them accordingly. Still, we have to integrate services by history taking, because if you don't find out from the client, how will you manage the client? You have to assess the client by trying to find out what the problem is. Whatever she tells you helps you to know where to refer the client. The other aspect is physical examination. When you examine the client, you can know what the problems are, which issues they have, and you are able to relate and refer them where they suit, where the services are suitable for them. Dear learners, we also need to know that client management is very important as an aspect of integrating services. This is based on the findings from client's history and physical examination, so the client is managed for any reproductive health need that has been identified. So we shall not take up all those aspects of history taking, physical examination, counseling, and that without doing client management. So that is quite very important. Ladies and gentlemen, we are looking at integration. We are saying if a client comes to your center, you also have to integrate other reproductive health services, such that by the time they leave your health unit, your health facility, they are able to say, okay, yes, this is how our health stands when you integrate the services. Any questions so far? Do you have any questions? Are you comfortable so far?